Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done. Remember, BART members get 15% off. The Barbados Diabetic Eye Screening Program.
Good morning! Good morning to Larry and all the people who are tuned into VOB. How are you doing this bright Saturday morning? I hope by the grace of God that you're alive and you are about to hear as me, Peter Boyce, welcomes you as the Barbados Diabetic Eye Screening Program and the Maria Holder Diabetes Center sponsors the next 15 sugar-free minutes on VOB 92.9 FM. Hope everybody good, home relaxing, listening to your radio. And you know, last weekend was a long weekend. But despite the fact that this weekend is shorter, let's make it short but sweet. But not too sweet. Because you know, on the Maria Holder Diabetes Radio Show, we try to get you to reduce that sugar intake, especially if you are a diabetic. But even if you're not a diabetic, by reducing that sugar intake, that could also stop you from becoming a diabetic. So remember that. But if you're a diabetic, you should already know about the Maria Holder Diabetes Center located in Warren, St. Michael. And on Friday, April the 29th, at the Diabetes Center, there was a special media event where, in order to raise awareness of the need for testing and screening to know your status and early detection for better outcomes with diabetes, the Maria Holder Diabetes Center for the Caribbean was officially visited by Prime Minister the Honorable Mia Amor-Motley and the Director General of the World Health Organization, Dr. Tedros. Did you see the coverage in the media? Well, in case you missed it, we will play you a little short piece. Next, you will hear from Prime Minister Mia Motley, a portion of the remarks she made at that event.
One may ask how it took so long for me to visit this center in my constituency. And it's largely because I'm flat out everywhere else. And those in my constituency have learned to lend me out on occasion. But when I come home big. And I really want to thank all of you for the opportunity to be here and to see the excellent work which is being done and to see it in real life with the patients who have been here this morning and to see the difference that it is making to people's lives. Barbados is a blessed country, and I acknowledge that across political administrations we have placed the provision of health care and education at the bedrock of our development. It therefore makes it easy for me to be able to go globally and to make the case for the Sustainable Development Goals, because we don't only talk the talk, we walk the walk in this country when it comes to these things. But I want to use this opportunity to speak to our people, to Barbadians, because the rate of increase in expenditure on dialysis and as a result of the loss of productivity from chronic NCDs has forced me in this government to have a minister who has direct day-to-day responsibility for chronic NCDs and the QEH, Minister Brown. And I've done that because I'm not satisfied that we are reaching as many of our people. And therefore, I've asked both Minister Brown and Minister Goodinegel to designate some champions who will help us with the change in public behavior. We already use the example of Mr. David Ellis with being a public advocate for COVID-19. And Mr. Ellis has now agreed to help us not just with the change of behavior necessary for COVID-19, but recognizing that reckless behavior and inappropriate behavior wherever it is found will lead to consequences. And whether it is reckless eating, bad eating, whether it is no exercise, whether it is the reckless driving or even the motorcycles that I see every Sunday afternoon now causing people to take their lives in their own hand when you hear and see a buzzing motorcycle drive in and out of traffic, whether drinking, all of these things have a price. And this government, as will future governments, wants to help keep Barbadians well. But we need the help of Barbadians to keep Barbadians well. Because as Christopher Holder said earlier, not only is the first act to make up your bed, the first act is to love yourself enough to take care of yourself.
Thank you, Madam Prime Minister. You hear what the Prime Minister say, right? You should love yourself enough to take care of yourself. And the Maria Holder Diabetes Center is there to help you. You know, on this show, you always hear me talking about the world-class standard of care and service you get at the Maria Holder Diabetes Center. Well, in case you doubt me, listen and hear what the Director General of the World Health Organization had to say about our Diabetes Center in his remarks.
Good morning to all of you, and it's such a great honor to be here with you today. I thank the Barbados Diabetes Foundation and the community here at the Maria Holder Diabetes Center for the Caribbean for hosting this important event. I commend the foundation and the center for its work, and especially for its focus on multidisciplinary teams with nurses, nutritionists, and a range of specialists from podiatry to psychosocial support, all provided free of charge to patients. The one-stop shopping that you have said. Your commitment to alleviating poverty and improving the quality of life of vulnerable populations through a comprehensive approach is an inspiring model from which other countries can learn. We support your vision to expand this approach to other countries in the region through your collaboration with PAHO WHO. And also during the visit, I was informed that the dialysis service per session is around $300 Barbadian dollars, and that's covered by the government, which, as you indicated, Dr. Holder, the fee for service. 3 sessions means $900 Barbadian dollars per week. And then, of course, per month, you can imagine. And that is a very strong commitment from the government. Imagine any patient here paying that amount of money. And that's why we support as WHO health as a rights issue, and that should be provided to all citizens, especially expensive services like this. It's very difficult for patients to access. I know that diabetes is a significant public health challenge here in Barbados with prevalence of more than 14%. Diabetes takes a huge toll on the individuals and families it strikes, but also on the economy. According to the Barbados Diabetes Foundation, diabetes costs this country $15 million in direct costs and $75 million in indirect costs, such as lost productivity. Globally, diabetes accounts for an estimated 1.5 million deaths a year, making it one of the world's leading causes of mortality.
Don't you feel proud when the Director General of the World Health Organization could speak about a local agency like that? We thank Director General of the World Health Organization, Dr. Tedros, for his commendable comments on the Maria Holder Diabetes Center and its efforts to fight the scourge of diabetes, including its efforts to protect your eyes with its Barbados Diabetic Eye Screening Program. You know, every week I come on this show and I beg you, if you are a diabetic, we don't want you to fall victim to diabetic retinopathy and end up going blind. Call and book that appointment to get your eye screen. Don't delay. The number to call is 243-EYES. 243-3937. And if you're thinking about money, remember BART members get a massive 15% off. But in case you is a doubting Thomas, are you still sitting on the fence and wondering, but how important is it for me as a diabetic to really get my eyes checked? Well, Dr. Charles Pierce, clinical lead of the Barbados Diabetic Eye Screening Program, responds,
the main reason that we monitor or have a screening process in place is to pick up early changes in the retina before they reach an advanced stage where intervention is unlikely to have the same effect. So what we're trying to do is pick up these diabetic retinopathy changes before they reach a stage where our intervention with an injection in the eye or laser will have less of an effect, and we're less likely to preserve vision or improve vision.
The doctor has spoken. You hear Dr. Charles Pierce, right? So find that phone and call now to make that appointment. 243-EYES, 243-3937.
For a long time, I was prolonging not to have my eyes, I went to get an eye screening. I checked for a long time. But because of I had a cataract operation 5 years ago at the hospital, and just about a couple months ago, Diabetes Foundation, they had called me, Dr. Prophet, send the message that they were doing the eye screening program, and I went and I had my eyes done. Both me and my fiance. And I can say that I was well satisfied with what they did with the result. Right now the cataract is under control. So I would say yes, that is very good. It's very good for diabetic. I would give it a 5-star.
The Maria Holder Diabetes Center, with their diabetic eye screening program, offers a standard of service that equals or surpasses any you might receive internationally. And very soon, there will be a dedicated vascular department added that will be the centerpiece of a new national preventative campaign that will highlight the discovery of early circulatory problems in the limbs and extremities of at-risk persons. So if you are diabetic and listening to your radio right now, you need to make an appointment and get your eyes screened. You can reach them by calling 417-0305 or 243-3937 to make that appointment. The last 15 minutes you heard on your radio was brought to you with the compliments of the Barbados Diabetic Eye Screening Program and the Maria Holder Diabetes Center. Until next time, take care of your eyes.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done. Remember, BART members get 15% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.